Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. I'm Dr. James Machino. Our topic today is prostate enlargement or benign prostatic hyperplasia. So the enlargement of the prostate often accompanies the aging process, as most people know. And the major symptoms of an enlarged prostate involve the restriction of urine flow. So men often have urgency. They feel like they have a need to go more often. Then there's hesitancy. They can't actually initiate urination that easily. There's frequency of urination, nighttime awakenings, an inability to completely void the bladder, and sometimes just a weak urine stream is the very first symptom that a man will experience. How common is the problem? About 50% of men by the age of 50 already have some symptoms of an enlarged prostate gland, and by age 80, about 75 to 80% of men have clinically important prostate enlargement, so it's extremely common. 50% of men will actually require treatment for it if they develop the problem. So why does it occur in the aging process? Well, as we get older, there's an enzyme in the prostate that builds up, or a hormone rather, that builds up called DHT, or dihydrotestosterone. And as it increases, it causes the cells of the prostate to divide at a much faster rate. When the cells divide faster, there's a greater number of cells, so the prostate enlarges. The other thing is that if they get fatter as they get older and their fat cells are larger, the fat cells are producing more estrogen, and estrogen blocks the breakdown of that dangerous testosterone, that DHT, so there's higher concentrations in the prostate. The cells divide faster. The prostate is now enlarged. It puts pressure on the urethra. It's much more difficult for a man to urinate. So the medical treatment for this has been to give men drugs that actually block the buildup of DHT, or dihydrotestosterone. Drugs like Avodart and Proscar do that. There's also drugs that relax the muscles around the neck of the bladder to allow urination to occur more easily. Drugs like Flomax do that. But there are nutrition and dietary factors that have been shown to be absolutely vital for the prevention of prostate enlargement. They can also reverse prostate enlargement if it's only at a mild or moderate degree. And also, these lifestyle practices have been shown to also be important in the prevention of prostate cancer, which now affects 1 in 6 men. So because these natural interventions of diet and lifestyle supplementation also have anti-cancer properties, this becomes important because the drugs that are used don't actually have anti-cancer properties, and it's an important consideration. So what are the most important dietary factors for prostate health? Throughout a man's lifetime, he should be on a low animal fat diet. High animal fat foods make cells of the prostate divide at a faster rate. They're linked to more prostate disease. Eating pan-fried foods contain certain types of carcinogens that are linked to an increased risk of prostate cancer. So that's a bad idea. Whereas eating more omega-3 fats from fish and fish oil have been shown to slow down the rate at which prostate cells divide and decrease prostate enlargement and prostate cancer. Consuming alcohol has been shown to increase risk of prostate cancer. A couple of reasons. It causes cells of the prostate to divide faster, that they make more genetic mistakes that can lead to cancer. And also, alcohol drives more cancer-causing agents into the cells of the tissues of the body. So alcohol is linked to prostate cancer. Eating more cruciferous vegetables, broccoli, Brussels sprouts, cabbage, cauliflower, bok choy, associated with a decreased risk of prostate cancer over a man's lifetime. There's some active ingredients in those vegetables like the indole 3-carbinol, which block the buildup of dangerous estrogen hormones and could get certain cells in the prostate to, if they're becoming cancerous, to commit suicide and have detoxification effects. But cruciferous vegetables linked to a prevention of prostate cancer. And so is lycopene, which is found in tomatoes and red fruits and vegetables. A lot of different pathways here. It helps the prostate cells mature so they're less prone to cancerous change. It slows down the rate of cell division by blocking certain receptors. And certain cancer cells, if they're forming, lycopene has been shown to encourage them to commit suicide before they become a dangerous threat to the rest of the gland. The same is true for soy foods. Soy foods contain isoflavones and other protective nutrients that have been shown to block the buildup of the dangerous testosterone, which is DHT, also encouraging prostate cancer cells to commit suicide, and blocking too much testosterone from getting into the gland, blocking estrogen receptors so you can't have an adverse effect on the prostate gland with too much estrogen, and other cancer prevention properties. So soy foods are an invaluable part of management of prostate health over a man's lifetime. And more recently, we've learned that pomegranate juice, 4 to 8 ounces a day, has some amazing protective effects on the prostate gland. It's even been shown to help improve the management of certain prostate cancer cases. In regards to supplementation, after the age of 40, men need to add a prostate support supplement. Why is this? Because after age 40, that's when the prostate cells convert more testosterone into the more dangerous type of testosterone called DHT. And there are natural ingredients, natural agents in nature that can block that buildup of DHT that have proven benefits in preventing prostate enlargement and even reversing mild to moderate prostate enlargement without any side effects. So all men really have to pay attention to this and should really act before it's too late. So my recommendation is you take a prostate support supplement that contains the following ingredients at the right dosages: saw palmetto, Pygeum africanum, beta-cytosterol, soy isoflavones, lycopene, and stinging nettle, even pumpkin seed extract. At the right dosages and standardized grades, each of these natural agents has been shown to not only stop prostate enlargement and reverse it, but also have important anti-cancer effects on the prostate gland. So most men should take 1 to 2 capsules a day for prevention. If there is already prostate enlargement, 2 to 4 capsules would be an even better dose to take. And you can take a supplement like that with other prostate medications. Other supplements to take that help the prostate gland: a high-potency multivitamin that has 400 IUs of vitamin E succinate, vitamin E succinate, a very anti-cancer type of vitamin E, as well as zinc, 1,000 IUs of vitamin D. Vitamin D, very important for prostate health. And an essential fatty acid supplement that contains flaxseed oil with fish oil with borage seed oil, has anti-inflammatory properties, and been shown to slow down the rate at which cells divide, and that's always an important feature in preventing cancer. And 2 tablespoons a day of ground flaxseed. Ground flaxseed powder contains ingredients that have been shown to slow down the rate at which prostate cells divide, less chance of enlargement, less chance of cancer development. So my final advice as well is to see a chiropractor and get your low back assessed by a chiropractor. I say that because nerves that leave the low back of the body send nerve impulses into the genitalia region. And any nerve pressure from misalignments of spinal bones can actually irritate those nerves and cut off the vital life flow to certain internal organs, leading to dysfunction and disease. So it's very common, for instance, with people that have low back pain, that they also have erectile dysfunction, urinary problems, constipation problems, because the nerve flow from the low back to those internal organs has been altered by that nerve pressure in the spine. But some nerve pressure in the spine, you don't feel it as pain. It's there on sort of a subclinical level. So a checkup from a chiropractor can find any spinal misalignments, correct them to optimize the life force energy that flows through those nerves into the important internal organs that we have, including the prostate gland. So if you're a man, I'd suggest that you take all of this advice very seriously. Prostate disease is a very common problem, but it's also very preventable. So please forward this newsletter to all the men that you know and care about, because all men should have access to this information. Most medical doctors don't stress the lifestyle approach to prostate health as much as the scientific research really warrants that there should be this conversation with the patient. So in the text below, you'll see the exact nutrition and supplementation program men should follow to help prevent and manage enlarged prostate problems, and also help to prevent prostate cancer. So I hope you found this informative. Thanks for watching, and I'll see you next time.